when it comes to cancer in India, is the low survival rates. It stands at around 30% of India's cancer patients survive for over 5 years. And almost 50% of cancer is seen in late stages in India. Is that primarily because of a late diagnosis?
I would say yes, primarily yes, because we have such poor screening rates. We have complete lack of awareness. We have extremely poor screening rates. We as a nation don't screen. And I'm not talking about screening of the poor. When we talk about screening, we talk about these vans where we are running camps and we are bringing in people for free screening. I'm talking about screening of regular people. Just think around yourself. Each one of us, 3 of us are here right now. Think around yourself. Is your family screening? Are your friends screening? We as a nation just don't screen. So we end up with late diagnosis. We end up with more advanced diseases, and we know that advanced diseases are linked with death and dying.
But Dr. Limaye, there are many cancers which cannot be diagnosed or are undetectable. There are lack of symptoms. For example, pancreatic cancer, lung cancer, cervical to a certain extent, ovarian, colon. What does one do in that case?
So there is a lot of work happening now with what I call new age diagnostics. So we are looking at the tip of the iceberg with the screening tools, and I think the real promise lies in figuring out cancers with the new age diagnostic techniques, whether it be AI-based chest X-ray to figure out lung cancer, or whether it be a blood test to figure out the presence of cancer in the body, or whether it be a urine test to figure out the presence of cancer in the bladder. All these techniques are really coming through. There's a body of work happening with great force. I see great promise in it. I was part of such research efforts from India, and I really feel that's the answer to the world. We just had a major publication as a cancer community in New England Journal of Medicine, where we saw a blood test diagnosing colon cancer. Similarly, we already are aware of a blood test that was presented by Johns Hopkins that could pick up 4 cancers. We are aware of GRAIL as a technique with Gallery as a test, which can predict a certain group of cancers in 40% of people.
Well, Dr. Rajappa, what does one need to be aware of in terms of symptoms when it comes to cancers which are difficult to detect?
I don't think there is one specific symptom can help you to straight away make a diagnosis of cancer. You need to be aware of those warning signs that are displayed all over, especially in the vans that we just discussed earlier. Change of voice, an ulcer in the mouth that is not healing, especially if you're a tobacco chewer, a cough that is not going away, finding blood in your spit, a mole that is enlarging in size, painful or bleeding, any change in your bowel habits as you're growing older. So these are some of the warning signs of cancer, as they would say. But remember that these are not specific for cancer. You grow older and you get any of these symptoms, and it's not getting better with the general remedies that you would take. Let's say you have a constipation, you would take a laxative, you would modify your diet and get on. But if it's not getting better in a few weeks' time, I think you should see a physician to get a colonoscopy done. If your cough is not getting better, with the usual things that we do, you should go and get a test done. So I don't think we should sit on these symptoms because there's nothing pathognomonic or 100% specific for cancer. Anything can be a sign of cancer. Some are non-specific, just feeling tired, having weight loss, not having good appetite. Tuberculosis can also have the same symptoms. So you can't be saying, I probably have tuberculosis, I don't have cancer, I don't need to be tested. Whether it's tuberculosis or cancer, it needs to be ultimately tested. So I don't think you should wait for one particular symptom to come. Anything that's coming on is not getting better, and you need to be tested to find out if it's not cancer, what else is it that's going on that's causing this problem.
Hey, thank you for watching this on CNBC TV18. Hope you liked it. For more such interesting news and updates, follow CNBC TV 18 on all the social media platforms.